Hi guys. We'd just like to thank you for coming, thanking everyone who joined us at this webinar today. My name is Catherine Davis and I'm a public health research intern for COVID-19 Greater Charlotte Area Mutual Aid, which I will be calling COVID GCA for short because it's a little bit of a mouthful. So COVID GCA is a mutual aid organization that was launched in March in response to the pandemic. And the mission of COVID GCA is to serve individual and community needs during the state of local, national, and global emergency. So we aim to accomplish this through consolidating available resources in the community, connecting assistance to those who are immediately impacted by the coronavirus, and also facilitating the distribution of aid through this collective effort. So the impacts of this public health crisis on the community pretty much everywhere are manifold, with homeless shelters are experiencing a shortage of supplies, local businesses are going under, and individuals are left in compromising, vulnerable, and isolating circumstances. In response, we're hoping to create a platform where members of the Charlotte community can help each other and uphold solidarity to alleviate the wider financial, social, emotional, etc. ramifications felt by the area. So to spread awareness about COVID-19, we've organized a public health webinar series titled 5 Weeks to Better Understanding COVID-19. Each week, we're going to feature a different topic, which includes remote learning and returning to school safely, facts and fiction of COVID-19, more of like a Mythbuster type of week episode, mental health, school athletics, and the economy and job market. So these webinars are held weekly on Wednesday evenings from 6:30 to 7:30 p.m. and they'll be streamed live or posted later to Facebook. Joining us as well is a cohort of CMS high school students who are eager to learn more about the pandemic and how it's affecting our lives. By the end of this 5-week series, the students are going to write a policy brief that will be presented to the CMS Board of Education, detailing the recommendations for how schools should proceed in the fall. So the topic for this week is returning to school safely in the fall, and it is our honor to present to you our guest speaker, Elyse Dashew. She is an at-large chair of the Charlotte-Mecklenburg Board of Education, elected in 2015. She has also served as vice chair of the school board for 3 years. Ms. Dashew has served on numerous CMS committees advocating for public education. So we're really excited to have her join us tonight and can't wait to hear what she has to say about what CMS is thinking about for the fall and the biggest things surrounding how to get safely back to school in the fall. So if you want to, you can take it away. We can ask some questions, whatever you want.
Okay, great. And before I dive in, could I just find out which schools, I just like to kind of get the lay of the land. So if I could find out what schools each of you attend.
So if we want to start with Tanushree, and then you guys can just make your way down with one person starts and goes and just let her know what school you're coming from.
I go to Audrey Kell High School. I'll just pass it to Aditi.
Yeah, hi, I go to Providence High School. Victor.
All right, I go to Providence as well. Let's go to Rowan.
I go to Myers Park. I'll pass it to Mo.
I go to Audrey Kell High School. I'll pass it to Nirvana. Oh wait, sorry, Rowan.
I already went, but I'll pass it to Keith.
I go to Audrey Kell High School.
And we can finish with we can finish with Anushka.
I go to Audrey Kell High School.
Cool. And did you all start the Mutual Aid Society, or was it around before? Is this like student organized, or I'm just trying to place? It feels like a student organized thing.
Yeah, Catherine McMillan was actually one of the members who founded it, if she wants to explain.
Yeah, I can briefly summarize. So this was launched directly in response to COVID-19. I'm a rising junior at Duke University, and so there was a mutual aid that started in Durham. And I was very inspired by that framework and movement that was sweeping across the country, wanted to do something in Charlotte. And you're right that this is a predominantly youth-led group. So that's why we also wanted to tap into this kind of programming to directly educate and inform youth about these things, since we're a huge stakeholder. So this started around mid-March.
Wow, this is really cool. And how did you recruit students, or how did students find out about this?
Andusha can take this one, I think.
Yeah, so I knew Catherine and Joey from middle school and high school. Well, Joey I went to middle school with, and Catherine high school. And I found out via social media that they were starting up this mutual aid related to providing assistance to the Charlotte community for COVID-related reasons. And so I decided that since this was an area that I'm interested in, because I'm majoring in health policy and management, I really like the intersection of policy and medicine. And so I thought this would be a great opportunity for me to gain experience in. So I just saw it because of word of mouth, also because I knew Catherine and Joey through various ways. Then the word just spread via social media and word of mouth to a lot of people.
Very cool. All right, I promise that's my last question. I just like to know how these things come about, because there's so much good that can come of it. Where do I start? I'll just say this is it's just like an impossible puzzle that we're trying to solve right now. It's obviously we need to get kids back to school. And at the same time, we have to be mindful of this health and safety of our students as well as our staff. And yet at the same time, when students are home, for a lot of our students, they're not as safe at home as they are at school. Because some kids just have, they just have a lot of challenges in their homes or in their neighborhoods. And school before COVID-19, school was a safe place compared to that. So you've probably heard that the governor and the State Board of Education have called on all school districts to plan for 3 possible scenarios. One is Plan A, which is everybody back to school, kind of like before the pandemic. Plan C is all remote. And then Plan B is a combination of the two with no more than 50%. And so our staff have been working probably thousands of hours planning for those 3 different scenarios. And the plan, the original schedule was that the governor was supposed to make an announcement on July 1st saying which plan he was calling for schools to open under, and then school districts could go with that, or could be more restrictive but could not be more lenient. So if he had called for Plan A, it would be up to the districts to decide whether we're doing A, B, or C. If he called for B, we could only do B or C. And if he called for C, we could only do C. And we do need to get this settled soon and announced, because I'm sure you all know, like you need to make your plans, your parents need to make their plans, your parents' bosses need to make their plans. But we in CMS need to do a ton of logistical work, and that depends on how many students are in the schools. Everything from ordering how much food to order. Are people eating food in the cafeteria, or is it all grab and go, or like we've been doing during remote learning? What classes do we offer? Where are staff assigned? Transportation, the buses need to plan their routes. That's something that usually starts in March. And so anyhow, the governor did not end up making the call on July 1st. So we're still waiting for that. And that's really got us all on pins and needles. So I guess your questions are more specifically about the remote learning. One thing that will be new this year is that even if we go back under Plan A, there will be an option for 100% remote learning for students who opt into that. And I don't have all the details on that yet for you, especially at the high school level. So, you know, I would love to be able to share everything, but some of that is still getting worked out. So anyways, that may be something to come back to at a later date, but not too much later. But that is an important option because there are a lot of students who have underlying conditions that, you know, make the health situation more critical, or they live with elderly parents or grandparents, and so, you know, or there are just some parents who are just saying, I don't care what the governor says, my kid's not going to school. And we want to give those students the opportunity to still be a part of CMS and still have a connection to their schools, to their teachers, hopefully to extracurriculars, you know, and to have the support of the curriculum so that, you know, if you end up going back and forth, you can flow more seamlessly from remote to the schoolhouse and back again. And we also don't want people to disenroll from CMS because, I mean, that sort of instability makes things really challenging for the system and also for the students. We see that a little bit already with charters, where, I mean, this was again pre-COVID-19, but if a student disenrolls from CMS, signs up for a charter, the money follows the student to the charter, but then oftentimes the student will find out the charter is not all that it was cracked up to be, and they will come back to CMS. And by then, you know, so if we had, like, say we had, I don't know, 20% of our students this year decide that they don't feel safe going back to school. If they all disenrolled, that would mean we would have fewer teachers. We would have funding for fewer teachers in the district. That would mean people would have to be laid off. And then if the students, if the parents were like, oh, you know what, this homeschooling thing isn't going to work out, you know, in a couple months, let's send them back to CMS, well, then their teachers are gone. So we really need a way to serve everybody's needs, whether it's remote or in the schoolhouse. So yeah, hopefully within days, we'll have an announcement from the governor that we can then respond to and say, you know, here's what our plan is going to be. But we're just kind of waiting on pins and needles for that. So do you want to go in? I do have your list of questions. I could just go through the list, or do you want to ask me anything now, or?
We could go through the list first, and then when questions arise up, when you're done with the list, we can just ask or have people ask questions.
All right. Well, you've got some great questions here. So your first question, will CMS be drawing on the plans and guidelines from other school districts, and any in particular? We have been following, I mean, we've been paying attention to school districts around the world, because there are schools in other countries that, you know, they're on a different calendar and they've tried going back to school already. And it's kind of a mixed bag. Right now, a lot of people that are pushing for us to have everyone go back to school in the schoolhouse, they're pointing out Denmark and Sweden, like a lot of Europe, Germany, a lot of European countries, that they've had pretty good results without increasing the spread. But there are some other examples, China, South Korea, and Israel, where they actually have gone back to school and then had to shut the schools down again. So there are other, you know, and the other thing that's important to look at when you're comparing notes with other countries is sometimes that's not apples to apples. So they may be better funded their schools might not be as crowded. They might be walking to school instead of taking long bus rides. They might have better healthcare systems for if someone does get sick. They might have better teacher morale in the first place. Right now, this is feeling really rough for our teachers. Because, I just think in America, we've kind of been piling and piling and piling on teachers for many years. And now we're asking teachers to potentially risk their health and safety to open up our schools again. And it feels like one last, like just one more thing to drag teachers down. And I hate that. Our teachers are so valuable. And so we need to be really careful about, if we fully reopen schools or even if we partially reopen schools, we need to be comfortable that our teachers are going to be safe. And, it sounds as though there's quite a bit of evidence that children are not big carriers of the virus. But at the same time, I think people are nervous, even people that are trying to follow the science, and we're not all epidemiologists. We're all suddenly armchair epidemiologists, but people, it's confusing, and it seems like the guidance keeps changing. So it's hard I think it's hard for some people to trust when you say children aren't carriers, or children can't get it, or don't get serious cases of it. Closer to home, are we following plans and guidelines from other school districts? We have been. I think a lot of the school districts in North Carolina have been comparing notes. So the superintendents are comparing notes. The chief academic officer compares notes with his buddies who are chief academic officers in other school districts. We compare notes quite often with Wake. They're the other kind of big urban district in North Carolina. In fact, we're both with our Plan B model that we're looking at. We have similar models where it would be students would go back to school for a week with a cohort of like a smaller cohort, smaller class sizes, about a third the size of your normal classes. And then you'd be doing remote learning for 2 weeks, and you'd be staggered. So after your week, you'd go off for 2 weeks, and then another group would come in the next week, and then they'd be off for 2 weeks. So that's very different, but that is something that Wake and Mecklenburg have kind of come up with, a similar model that we've both come up with. So that's answering question number 1 about how we're comparing notes with other school districts. Then your second question, how will CMS guarantee immunocompromised students get the same quality of other students who attend in-person classes if there are in-person classes? So like I said, we will have a digital or a remote option for all students. We already have a remote high school that a lot of students use for either if they just, they just have a different learning style and conventional high school isn't the right model, isn't the right fit. Or I knew a young lady who was a very, very serious dancer. And so she just, her dance hours were crazy and she had to do quite a bit of traveling. And so she did the virtual school. So that school already exists. It's being, that's at the high school level. What's new this year is we're making it K through 12. And the K through 8 part of the school will be connected with your own school. So if you're in elementary school, you're still in touch with the teachers at your elementary school. You're still enrolled at that school, but you're doing all remote. So will it be exactly the same experience? No. The curriculum, the lesson plans that have been developed, the academic team they're actually really excited about this. This is maybe a silver lining of all of this. There's some really strong plans that they put together. And it'll be a combination of synchronous and asynchronous learning. So synchronous means like a Zoom call where everyone's like this, where everyone's on at the same time with their teacher. Asynchronous means kind of like Khan Academy. You watch something, you do it at your own pace. You just have to turn your assignment in on time. Some of that I think is going to be led by kind of like star teachers, like someone who might be like the best second grade teacher in the district, just a real rock star. So, you know, that's going to be a way to, it could actually end up in its own way, be a way to advance equity in our districts, so that, because that's one of our goals, regardless of the pandemic, one of our equity goals is that we need more rigorous classes and just really enriching classes across the board. And sometimes in our schools with a lot of children who live in poverty, the standards have kind of been watered down, and that's something we're really trying to address. And so this will be a way to get like really high quality curriculum and teaching to students across the board, no matter their zip code. But you know, it's brand new, so we'll have to see how it works. I mean, I just want to be realistic about that. But there's some promise there. So you have a question, how is CMS making their plan for the fall? Is there advice from the governor, Department of Health Services, and others? Are there contingency plans if the outlook in North Carolina gets worse? So yeah, I covered some of that. We talked about the governor. We also have guidance from DHHS on how to safely do social distancing, and, you know, guidance on the temperature checks, and, you know, so like I said, with Plan A, Plan B, and Plan C, those were all developed in alignment with that guidance. And then contingency plans, yeah, it's very possible that even if we were to open in Plan A, within one school year, we could go from A to B to C, back to B, back to A. I mean, it could happen with these public health. I mean, I've heard the county health director and also the people at the state level talk about, it's when you're like trying to ease out of a pandemic, it's like you kind of tap the gas, ease your foot on the gas, and then you tap the brakes, and then you know, so it could be like that. On the federal level, there has not been a whole lot of guidance. There was some CDC guidance on how to safely reopen schools. It's starting to become more and more political in a partisan kind of way, and that worries me, without picking a side partisan wise, but it worries me. And so I just heard, just before we came on this call, the president is making a big demand that all schools reopen, and someone told me, I haven't confirmed this, but someone told me that that had demanded that the CDC revise their recommendations. And so I don't know if that's really going to happen. I mean, the CDC recommendations need to be based on science, not on politics, and I trust that that will be the case. But if they do revise their recommendations, we'll just have to read that with our critical thinking hat on to see. But so it's complicated out there, guys. How is CMS planning to keep teachers safe this year? Will they be providing PPE, hand sanitizer, and thermometers? So yes, we will be providing those things. We're ordering lots and lots and lots of masks and the face shields and hand sanitizer and thermometers. We're making a plan for how to do temperature checks, which will be time consuming. There's a concern about how much does that eat into instructional time. But that we're making those, that's the world we live in right now. So we are making those plans. We did our our HR department actually sent out a survey yesterday to teachers to find out what teachers plan to, come back into the classroom, and versus if teachers had any either health conditions or just extenuating circumstances that would make them not comfortable coming back to the classroom. And in that case, we're going to do our best to find remote assignments for teachers. So like I said, we're talking about having, remote learning available. Well, we may have teachers who may opt to be remote teachers as well. Hopefully those numbers will match up. And there will be a room, like if a child comes down with symptoms, there will be a room for that student to go to, not the regular health room, but another room. But one question, another question is, well, then what if you have a whole bunch of kids? Like, what do you do with if a bunch of kids come out with a fever, or, it's a lot of questions. I think about even just if a regular bug starts to go around, or if flu season hits, how do you know what's coronavirus versus what's some other virus? So we've got all that to look forward to. But I will say that we have to keep our teachers safe. So I don't ever want any teacher to get the impression that their safety doesn't matter. We need to keep our kids safe, and our teachers, and all of our staff, our custodial staff, our people that are making lunches, everybody. So it really troubles me that there's a sense that public school employees, that their safety is not being valued, and it certainly is being valued by us. So when will guidance for the fall be communicated? Is there a projected date? Whew. I think you can sense my tension about that. The projected date was last week. So ASAP, that's all I can say, ASAP. If planning for a remote online semester, will CMS ensure that students receive a science lab-based experience? If so, how? That's one that I'm going to have to get back to you on. I don't have the answer to that one at my fingertips. That's why, the plan B, I'm hoping we can work out a way at least to do a plan B. And then perhaps on, the week that you are at school, you can get those sorts of things in. We gotten a whole bunch of emails from students at Northwest School of the Arts too, who have a lot of their schooling involves being together in the same room and doing things that are hands-on that, you may or may not be able to do remotely. So that's a big, consideration for the year coming up. Given the uncertain nature of the pandemic, is CMS considering a pass-fail grading system? That is not something that we would unilaterally change on our own. That is some moving from regular grades to pass-fail would come from the state. And I know they did that in the spring. That was unprecedented, but they did that in the spring because so many students across the state were not able to get, access to technology to do their assignments. And it was a huge equity issue, and it would be unfair to have some students left out and other students moving forward with awesome GPAs. So now I think districts have had time to be better prepared for remote learning. And I know in CMS, we're very, very lucky in that we have been working towards being one-to-one with our technology for many years. So we've really invested a lot of time, talent, and dollars into that. And so we were better positioned than others. And we do anticipate being able to have, between our federal relief funding and a lot of community support, we do expect to be able to have a device for every single student K through 12 this year, as well as internet, helping them with internet access if they don't already have internet access. All that is to say, I don't anticipate going to pass fail unless something huge happens statewide. Let's see. And then, your last question. If planning for a remote online semester, how will CMS students be aided if they don't have access to stable, reliable internet connection or a personal computer at home? So we did just talk about that. That is something where the community has really pulled together, but we'll need to stay on top of it. And I really am concerned about for students, if we end up with either Plan B or Plan C, there are some students who do have blazing fast internet and, their own desk and supportive, parents who are working from home and have the time and the mental bandwidth to help figure out assignments. And then you've got some kids who are just, experiencing homelessness, and a lot of kids are experiencing homelessness and live in houses that are really crowded. Lots of people living together might have some major health issues and a lot of stress in the house with their loved ones. Crime, in the neighborhood, and no one to help them figure out how to do their assignments, or no one who speaks English to help, even work with understand from the school what needs to get done. It's amazing how many of our students are the translators for their parents. And so we need to really keep an eye on that. And I feel like we need to raise awareness in the community and find ways together with the community to support these students, whether it's somehow some kind of distance tutoring or mentoring. But our social workers stayed very, very busy during the springtime school closings, and I anticipate we'll be all still very, very busy. Their jobs are so important too right now. So that's really important that we, I think we've had huge equity issues before the pandemic, but the pandemic has really exacerbated it, so that the remote learning gives some students a big advantage and some students a big disadvantage. And then you combine that with medically, it's hitting a lot of, the community, and we talk about the crescent and the wedge. It's hitting families in the crescent so much harder. And so I really worry about the damage that does to all of us as a community going forward.
All right, so if you have a question, feel free to raise your virtual hand and Catherine will call on you. Do we see any right now?
It'll probably be Killen that calls on you because he's the host of the meeting. But I just want to say that the answers to those questions were great. And personally, I graduated from Providence in 2017, and I have a dad who teaches at Providence and also a sister who goes to Providence. So my biggest two things when I think about going back to school in the fall are keeping teachers safe and students safe, just because I have a dad there and I have a sister there. So I really appreciate CMS looking out for both sides of that spectrum.
Mm-hmm.
Right, so Killen, do you see any hands? while we wait for that, I actually have a quick question about PPE. I was curious about, it's great that like CMS is planning on providing PPE for like teachers, but I was wondering if it would be also provided for other staff members, like bus drivers, for example.
Yeah, and in fact, the guidance changed last week as far as masks being required and recommended and required for students as well. Not necessarily the littlest kids, but everybody else. So that made our staff go, oh, we need to put in another order. And, you know, and there are, just imagine every district in the nation is going through this. So we're all kind of like grabbing what PPE we can get. But yeah, that is the plan. That is the plan. And in fact, a nonprofit just reached out to me today, they've figured out a way to make face shields that are for little kids, and they've got a grant to help pay for it, and so we're connecting them with some people on our staff. So there's been some really wonderful community support as well. A couple of our board members they're good at sewing, and just to keep busy when they're nervous about stuff, they're just constantly sewing more masks and more masks and more masks. So we did a drive over the summer, and people made 1,000, a little over 1,000 fabric masks for the folks that were over the spring that were serving meals to students. And so there's been a lot of that going on too. But yeah, I think it would be good. I guess masks are not currently, the health experts are not saying you have to require them for the little kids, but a lot of people think it would be good for them to wear them anyway. So I think if you have younger, little siblings or friends with little kids, it might be good over the summer for them to just start practicing wearing a mask and get comfortable with it. But ages 11 up, you're supposed to wear masks. And staff, yeah, not just teachers.
Awesome. Thank you so much. I think Aditi has a question.
Hi, thank you so much for speaking. I was just wondering if there's some kind of like protocol or plan, like if one school does have an outbreak, would some kind of shutdown apply to all of CMS or just that one school or area?
Yeah, and I don't have all of that. I don't want to answer that wrong. I don't think one outbreak at one school would mean the whole district would shut down. But honestly, I'm not well versed yet on how we would handle that. Would it be just the class? Would it be the whole school? For how long? Would they then have to make up the days? Those are all really important questions to answer that I don't have those answers just yet. Not saying nobody has those answers, but I, as a board member, don't know the answer to that just yet.
Thank you. I think Mona has a question as well.
Hi, yes. I'd also like to thank you for speaking. That was really informational. But I was also wondering, regarding the PPE, would we be providing students with N95 masks, or would they just be like the typical like the cold cough masks that we would be giving out?
I'll have to find out that for you too.
Okay.
Yeah.
Rowan?
Hi, thank you for answering all of our questions so thoroughly. I just had one more question. I was wondering, after talking with friends and everything, I feel that many students have fallen out of touch with like previously learned material, and I feel that increased remote learning would only increase these like feelings of not knowing the subject that has been taught. So do you think that, say, like upcoming seniors would be held to the same curricula expectations as previous seniors from previous classes, or would the structure of the subject change to accommodate for these times out of school?
Oh, that's a really good question too. And I wish we had our chief academic officer or our, someone like that on the call to answer those sorts of specifics. Some of this also depends. Yeah. I mean, I think we're going to have to give grace, and I think colleges are going to have to give grace to our students. And because it's not just in CMS. I mean, I know students, especially at the schools that you guys represent, there's a lot of sense of competition. But we're all across the nation experiencing this together. And so I hope that colleges can take that into consideration. And I will say, I mean, there are probably lessons that you all are learning from going through this experience that are giving you wisdom that the students, a few years ahead of you don't have. But some of that book learning may be a little bit different in exchange for that. But as far as, are we changing the curriculum? Are we slowing things down? Are we doing review? Are requirements changing? I mean, I don't think graduation requirements are changing. Again, that would be a state level decision. But as far as review and that, I don't specifically know the answer to. Right now.
Do we have anyone else from the cohort that has questions? I know you guys all have a few written down throughout the talk, so feel free to raise your hand or just unmute yourself and ask away.
Yeah, I think Aditi may have another question.
Yeah, so I guess this kind of goes off her earlier question, but also with final exams, will they maybe be weighted as much as like they currently are, because some people are going to be out of school and then like it's just going to be different?
Yeah, that, again, these are really granular questions. They're very important, but I haven't come across them yet. So typically a question gets sent to me and I relay it to staff. And so that's another one that I don't have the info for you yet.
I have a question if nobody else has a question. So I know that like a school like Providence is not necessarily overcrowded, but a school like Audrey Kell or Myers Park or South Mac, they have so many students. Are there different plans for a school like South Mac or Myers Park versus Providence? I know Providence has a lot of kids, but nothing compared to the size of those other schools. So I'm just thinking like, Providence might be able to accommodate 50% a lot more reasonably than somewhere like South Mac or Myers Park.
Yeah, no, right now it's the modeling is that the third, 1 week on, 2 weeks of remote works across the system. And I don't think we've looked at different models for different schools. Kind of could run into an equity issue there too. And also, I suppose that depends on how many students opt out for 100% remote. I'll be really interested to see if that happens, and if so, if there are geographical concentrations of where that happens, which might change the student in school student populations in a way that we're not anticipating right now. But the simple answer is I don't think we expect to have, 50-50 model at one school and a third at the other. Because the other thing is we're all using the same buses. Those bus routes have to be planned. And, a lot of the curriculum, yeah, that would be tough to do a patchwork like that.
Great. Victor, I think Victor has a question.
Yeah, thanks for talking to us. But I guess like this might seem like a little bit more like broad, but like what is CMS doing to like if we did go all remote to like ensure that like all students actually participate? Because I know like a lot of students like in the past like didn't really do work, and like you guys kind of accounted for that, but like just in general, like what, like do you guys have plans for that? Or
Yeah, I mean, so in the spring, it was a lot of just sort of do your best, and the grades were not as much of a factor. And if you fall behind, that's okay. You don't have to get everything turned in. And that again was that was partly because everything happened so quickly, and so many students across the state couldn't even access the remote lesson. So that's part of what was behind that. I don't think it's going to be that laissez-faire now. So I think there will be consequences if students are not doing their work. But I get that it's tough when you have your distractions at home, and you've fallen out of the habit, and it's going to take a lot of self-discipline, a lot of internal motivation. But there will be homework, there will be tests, there will be assignments that will be graded. So that's going to be a little bit more like the olden days, the pre-pandemic days, whether we're remote or not.
I also had a question regarding the cohort system you were talking about earlier. I thought that was a really like interesting way of approaching the pandemic and education during the pandemic. But I was wondering if it would lead to A, a longer school year, and B, longer hours worked for teachers and faculty.
Hopefully not a longer school year, and hopefully not longer hours. But that is actually, school districts are sorting that out right now, and not so much from the cohort standpoint, but from, how much time does it take to do all the temperature checks, and how much does that take away from instruction time, and what do you do about that? So that is something that a lot of districts are figuring out right now. As far as, I do think it's going to be a lot of work for our teachers to be responsible for the students in the classroom as well as the students that are learning remotely. And I hope that with the teachers that are teaching remotely, that we can do some teamwork to address that, and the way that the remote lessons are being developed, so that teachers don't have to invent them all by themselves. I hope that helps. I hope that the fact that teachers will have smaller class sizes, 1/3 the size, that will help with, certainly with classroom management and with more one-on-one attention when the students are in the building with you. But it's, it's going to be a lot regardless.
Great. I think Kia has a question.
I wanted to say thank you for talking to us. It was really informational. So I was actually wondering, if we do end up going back to school for using Plan A or B, would students be required to get tested for COVID?
I don't think we're going to require, I've not heard that we'll be requiring testing for all students. So it will be more of symptom checks and temperature checks. Parents will actually have to, and this has been happening in preschools as well as in some camps, where parents have to actually attest. You have to look someone in the eye and say, yes, my child has no symptoms. I was talking to a friend whose son's been going to daycare, or to preschool, and she said, if they forget to ask the question, she's like, now ask the question. It's important. You have to ask me. And so will there be parents who will not tell the truth? Maybe. I hope not. But I think when you're being asked face to face, it's, and the stakes are so high, I think that brings out a better angels. So, so then there will also be the temperature checks.
Great question. I think Catherine also has a question as well.
Hi, yeah, thank you so much for being here with us. It's been really informative. I have a question, kind of more of like a reflection kind of question. What are some of the lessons that CMS has learned from the crisis response of getting everyone online, and where do you see some of those lessons taking CMS into the future, even beyond COVID?
Let me think about that. For sure, it's important to be flexible, and to communicate things when you know them, but then not over communicate. And so there were a couple of instances with when the schools closed down, it was really confusing for a while because you'd get one set of rules or regulations or guidance, and our staff, our people would leap into action and implement it, communicate it. And then 2 days later, Raleigh would reverse. They would say, actually do the opposite now. And then we'd have to jump out and communicate that to everybody. And people would just get more confused and more anxious. So it's this sort of delicate balance of, when guidance comes out, make sure we really understand it and then communicate it, but also, don't get ahead of things, but don't sit on it too long either. And a lot of what I'm doing here where I say, I don't know that yet, we have to get comfortable with saying that too. And asking for help when we need it. I think that's an important lesson. With the community really rallied to help us raise money for Wi-Fi hotspots in the spring. And so that sort of welcoming that kind of support was a good practice. Like I said, the academics team, they're really excited about the way some of this digital learning is hopefully going to work. But first of all, I'm not an academic expert, so I'm going to trust them on that. And also, I haven't seen it for myself. We haven't seen it play out in the real world. I'm sure there are a lot of lessons to be learned in the coming year, but they did have time. They kind of took what they developed last spring. They developed that so quickly, but they got some really good ideas and feedback from it, and it really built upon it. So they're very excited about that portion of what we're moving into. So I'm trying to think. Those are probably the lessons learned at the moment. There will be much more. I think the lessons are still being learned.
Thank you for the reflection. I think Janushree also has a question.
Oh, I was gonna ask, but then that was more of like clubs related. But I mean, if it's okay if we're gonna ask the question.
Sure. I mean, it's fine with me if it's okay with you guys.
So like, if like CMS is like thinking of, like going with the plan for sending 1/3 of the kids to school, like half of them at home and some of them in school. Will they still be going with the plan of doing clubs and other activities outside?
I hope so. That's one of those things that it was really just a week ago that these plans that I've talked to you about, A, B, and C, were released to the principals. So now it's sort of in the principals' court to fill them in and enrich them and figure out what they can make happen at their schools. Teachers, I think, will have a lot of good feedback on that too. So I hope that there will be clubs and extracurriculars. It will all, some of it may have to be remote like this, but I think a lot of us, we've gotten used to doing Zoom. And or some of it maybe, you know, everybody meets outside. I don't know. I'm not sure what it will look like. But I certainly hope that we can do that because it's such an important part of the school experience and the social experience. So I really hope we don't have to give that up. And of course, you know, a lot of clubs, you need teachers to be advisors, and I don't know how stretched thin our teachers will be, but I hope, the answer is I hope so.
Great. Well, I think Anusha has one last question before we wrap everything up.
Did you say Anusha or Anushka?
Anusha.
Yeah, so I was wondering, since it's easy to think about, like, you know, people can easily follow public health guidelines and like they know the sense of public responsibility, or hopefully they do. But when it comes to elementary schoolers and even middle schoolers, how do we approach having elementary and middle schoolers follow guidelines such as social distancing, maintaining 6 feet apart, wearing masks and stuff like that?
They've been doing it in daycares and they've been doing it in camps, so I believe it's possible. I think kids are capable of a lot more than we give them credit for. But at the same time, it's not going to be perfect. So I myself have a lot of questions as to how this is going to play out in the real world. It would be disingenuous of me to say anything else. We'll just have to figure it all out together.
All right, I believe that was the last question. Thank you so much, Chairwoman Dashew, for taking time out of your very busy schedule and answering a lot of these questions.
Your questions are awesome. And if there are any, I actually didn't keep good notes, but I know there were quite a few where I said, I don't know yet. If you have a list of that, I'm happy to try to hunt those down for you. It may be things that we don't even have answers for yet, or it may be that people that are smarter than me have the answers for right now. So if you do want to send me those, I'll see. I'll try to get them answered for you. And good luck.
Thank you.
Washing your hands and follow, you know, wear your mask, and fingers crossed we'll all get back to school together.
Thank you.
All right.
Thank you so much.
Bye.